Have you ever woken up in the middle of the night, feeling that throbbing pain in your temples? Or perhaps you've been startled to see the numbers on your blood pressure monitor climbing higher and higher, while your doctor shakes their head with concern. I know exactly what it's like to live with that constant fear. Checking your blood pressure multiple times a day, carrying medication everywhere, avoiding joyful moments with family because you're afraid that the emotion might make your heart work too hard. Hypertension steals more than our health. It steals our peace, our freedom. And the worst part is hearing those same generic recommendations. Cut the salt, lose weight, take your medications, as if it were that simple, right? After years of helping people like you regain control over their blood pressure, I've discovered solutions that your doctors rarely mention. Natural, accessible solutions that really work. In today's video, I'm going to share with you 8 powerful foods that can naturally lower your blood pressure and transform your cardiovascular health, just as they have for hundreds of my patients. Imagine being able to gather with your grandchildren without worry, travel without fear of an emergency far from home, or simply wake up without that feeling of heaviness in your chest. This isn't just another empty promise. It's a proven path that you can start today with simple foods and habits that are already within your reach. So stay with me until the end, because this could be the most important video you will watch this year for your cardiovascular health. Before we begin, I'd love to know if you or someone in your family suffers from high blood pressure. Leave a comment below sharing your experience or any questions you have about the topic. And don't forget to subscribe to the channel and turn on notifications to receive more content that can transform your health. Let's start with some surprising facts about hypertension in America that most people don't realize. Did you know that nearly half of American adults have high blood pressure? That's about 410 million people walking around with a ticking bomb in their chest. Even more shocking, only about 1 in 4 of those people have their condition under control. But here's what really concerns me as a health professional. Hypertension contributes to more than 500,000 deaths every year in the United States alone. That makes it more deadly than many forms of cancer combined. And yet we don't talk about it with the same urgency. Why? Because hypertension is silent until it's not. It doesn't announce itself with dramatic symptoms until significant damage has already occurred. That's why they call it the silent killer. But I believe that with the right knowledge and simple changes to your daily habits, you can take control over your blood pressure and add years of quality life to your future. Now, you might be wondering, what makes these 8 foods so special? How can something as simple as what you put on your plate make such a dramatic difference in your heart health? It all comes down to understanding how your cardiovascular system works. Your blood vessels are lined with a thin layer of cells called the endothelium. This delicate tissue helps regulate blood flow and pressure throughout your body. When it becomes damaged or inflamed due to factors like poor diet, stress, or environmental toxins, your vessels can't dilate properly. They become stiff and narrow, forcing your heart to pump harder just to move blood through your system. That's hypertension at its core. The foods I'm about to share with you contain specific compounds that help repair this damage, reduce inflammation, and relax your blood vessels. They work with your body's natural mechanisms, not against them, like some medications that simply force your pressure down without addressing the underlying causes. The first powerful food that can help control your hypertension naturally is beetroot. This vibrant red vegetable might stain your fingers, but it can work wonders for your blood pressure. Beetroot is exceptionally rich in dietary nitrates, which your body converts into nitric oxide. Nitric oxide is a molecule that helps your blood vessels relax and dilate, allowing blood to flow more easily and reducing the pressure on your arterial walls. In one remarkable study published in the journal Hypertension, researchers found that drinking just 1 cup of beetroot juice daily lowered participants' blood pressure by an average of 8 points systolic and 4 points diastolic within 24 hours. That's comparable to what some prescription medications can achieve, but without the side effects. How should you incorporate beetroot into your diet? You don't need much. Just half a cup of cooked beetroot or a small glass of beetroot juice daily can make a significant difference. If you don't enjoy the earthy taste,
Try roasting beets with a little olive oil and balsamic vinegar, which brings out their natural sweetness. Or add them to smoothies with berries and a touch of ginger to mask the flavor while keeping all the benefits. Remember, the effect of beetroot on blood pressure is temporary, lasting about 24 hours, so consistency is key. Include it in your diet several times a week for the best results. One important note: if you're taking medications for erectile dysfunction like Viagra or Cialis, speak with your doctor before significantly increasing your beetroot consumption, as the combination can cause an unsafe drop in blood pressure.
I want to take a moment to ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers on your test, but how you feel living with this condition day after day. Many people tell me in private how isolated they feel, as if no one really understands the constant weight they carry, that silent fear that accompanies every heartbeat. If you identify with this, I would really like to hear your experience in the comments below. It can be something simple like, "I've been fighting hypertension for X years, and what afflicts me most is your biggest concern." Sharing your story not only helps me create more relevant content for you, but also shows other people watching that they are not alone in this battle. Sometimes knowing that there is someone going through the same situation already brings immense relief. And who knows, your experience might be exactly what someone needed to read today to find hope. Now, let's continue with our conversation about how we can transform this reality together. The second food that can significantly impact your blood pressure is fatty fish rich in omega-3s like salmon, mackerel, and sardines. These fish contain high levels of EPA and DHA, two types of omega-3 fatty acids that have been extensively studied for their cardiovascular benefits. Omega-3s work in multiple ways to lower blood pressure. They reduce inflammation throughout your body, including in your blood vessels. They help decrease the production of compounds that constrict your blood vessels. And perhaps most importantly, they improve the function of your endothelium, that critical inner lining of your blood vessels I mentioned earlier. In a comprehensive analysis of 70 clinical trials, researchers found that omega-3 supplementation lowered systolic blood pressure by an average of 4.5 points and diastolic pressure by 3.0 points in people with untreated hypertension. The effect was even more pronounced in older adults and those with more severe hypertension. What makes this particularly impressive is that the benefits of omega-3s extend beyond blood pressure. They also reduce triglycerides, decrease inflammation, and may help prevent irregular heart rhythms. Aim to eat fatty fish at least twice a week, with servings of about 4 ounces each time. If you don't enjoy fish or are vegetarian, consider algae-based omega-3 supplements, which provide the same form of omega-3 found in fish. Plant sources like flax seeds and walnuts contain a different type of omega-3 called ALA, which your body converts to EPA and DHA in small amounts, but they're not as effective for blood pressure control. For those concerned about mercury in fish, choose smaller species like sardines, herring, and wild-caught salmon, which generally contain lower levels of environmental contaminants while still providing plenty of beneficial omega-3s.
Our third blood pressure-lowering superstar is the humble garlic. This pungent bulb has been used medicinally for thousands of years across cultures, and modern science is now validating what traditional healers have long known. Garlic contains a compound called allicin, which is released when garlic is crushed or chopped and left to sit for about 10 minutes before cooking. Allicin and other sulfur compounds in garlic stimulate the production of hydrogen sulfide in your body, which helps relax blood vessels. Additionally, garlic has mild blood-thinning properties that can improve circulation. A meta-analysis of 12 studies found that garlic supplementation reduced systolic blood pressure by an average of 8.3 points and diastolic pressure by 5.5 points in people with hypertension. This effect was seen when consuming about 600 to 900 milligrams of garlic powder daily, equivalent to about 2 to 3 cloves of fresh garlic. The blood pressure-lowering effect of garlic tends to build over time, with the most significant benefits appearing after 8 to 12 weeks of regular consumption.
Fresh garlic provides the most potent effects, but it needs to be properly prepared to maximize allicin production. Crush or finely chop the garlic and let it rest for 10 minutes before cooking. Add it toward the end of cooking to preserve more of its beneficial compounds. If you find the taste or odor of fresh garlic too strong, aged garlic extract is an excellent alternative that has been well studied and shown to effectively lower blood pressure without the pungent smell. One word of caution, garlic can interact with blood-thinning medications like warfarin and even aspirin. If you're on these medications, consult with your healthcare provider before significantly increasing your garlic intake or taking garlic supplements. Moving on to our fourth powerful food, pomegranates. These ruby-red fruits packed with juicy arils contain potent antioxidants called polyphenols, particularly a unique compound called punicalagin. These antioxidants help protect your endothelium from oxidative damage and enhance the production of nitric oxide, similar to beetroot, but through a different mechanism. What's fascinating about pomegranates is their ability to protect the nitric oxide already in your system from breaking down, essentially prolonging its blood vessel relaxing effects. A study published in the journal Atherosclerosis found that drinking just 2 ounces of pomegranate juice daily for 2 weeks reduced systolic blood pressure by an average of 5 points. Even more impressive, longer-term consumption showed benefits for reducing arterial plaque and improving overall cardiovascular health. The best way to enjoy pomegranates is either by eating the seeds fresh or drinking unsweetened pomegranate juice. When buying juice, look for the varieties with no added sugar, as many commercial versions contain significant amounts of sweeteners that can counteract the health benefits. A daily serving of 8 ounces of juice, or about half a fresh pomegranate, can provide therapeutic benefits. If the tartness is too much for you, try mixing pomegranate juice with sparkling water for a refreshing, blood pressure-friendly beverage. Pomegranates are seasonal, typically available from October through January in the United States, but the juice and frozen arils are available year-round. Like garlic, pomegranate can interact with certain medications, particularly blood thinners and even some drugs used to lower cholesterol. The compounds in pomegranate may affect how these medications are processed in your liver, potentially increasing their concentration in your bloodstream. If you're taking these types of medications, it's best to speak with your healthcare provider before making pomegranate a regular part of your diet.
Our fifth blood pressure regulating food is dark leafy greens, including spinach, kale, arugula, and Swiss chard. These nutritional powerhouses are among the most potent foods for hypertension control, primarily due to their high potassium and magnesium content. Potassium helps your body eliminate excess sodium through urine, which directly lowers blood pressure. It also helps ease tension in your blood vessel walls. Magnesium, meanwhile, helps regulate blood pressure by relaxing the smooth muscle cells in your vessel walls and supporting the function of your heart muscle. Beyond these minerals, leafy greens contain nitrates similar to beetroot, as well as unique plant compounds that have antioxidant and anti-inflammatory effects. Research published in JAMA Internal Medicine found that people who consumed the highest amounts of plant nitrates, primarily from leafy greens, had lower blood pressure and a 21% lower risk of developing hypertension over a 10-year period compared to those consuming the least. The beauty of leafy greens is their versatility. You can incorporate them into almost any meal. Add a handful of spinach to your morning smoothie, where the sweet fruits will mask its flavor. Use large lettuce leaves as wraps instead of tortillas. Sauté kale or Swiss chard with garlic and olive oil for a perfect side dish. Even easier, start meals with a simple salad dressed with olive oil and lemon juice. Aim for at least 2 cups of raw leafy greens, or 1 cup cooked daily. If you're taking blood-thinning medications like warfarin, be cautious about suddenly increasing your intake of dark leafy greens, as their high vitamin K content can interfere with these drugs. Instead, work with your healthcare provider to maintain a consistent intake so your medication can be adjusted appropriately. The sixth powerful food for naturally controlling blood pressure is berries, especially blueberries, strawberries, and raspberries. These colorful fruits are rich in anthocyanins, the compounds that give them their vibrant hues. Anthocyanins belong to a class of antioxidants called flavonoids that have demonstrated significant benefits for cardiovascular health.
They help improve the function of your endothelium, leading to better blood vessel dilation and reduced pressure. Additionally, they have anti-inflammatory properties that can help reduce arterial stiffness. A landmark study from Harvard University followed more than 34,000 people for 14 years and found that those who consumed the most anthocyanins, primarily from berries, had an 8% reduced risk of developing high blood pressure compared to those consuming the least. This might not sound dramatic, but it's actually a significant reduction for a single food component. Another study found that women who ate more than 3 servings of blueberries and strawberries per week had a 32% lower risk of having a heart attack compared to those eating berries once a month or less. Fresh berries are ideal, but frozen varieties are just as nutritious and often more affordable, especially out of season. Add them to oatmeal, yogurt, or smoothies for breakfast. Keep a container of mixed berries in your refrigerator for a quick, sweet snack that satisfies cravings without raising your blood pressure like processed sweets would. Even dried berries without added sugar can be beneficial. Though they're more concentrated in calories, aim for at least 3 servings of berries per week, with a serving being about a half cup. For those managing diabetes alongside hypertension, berries are an excellent fruit choice as they have a lower glycemic impact than many other fruits while still providing blood pressure benefits.
Our 7th blood pressure regulating food is plain unsalted nuts, particularly pistachios, almonds, and walnuts. Nuts contain a perfect storm of nutrients for heart health: healthy monounsaturated and polyunsaturated fats, plant protein, fiber, potassium, magnesium, and L-arginine, an amino acid that helps produce nitric oxide. This combination makes them particularly effective for improving blood pressure. In one study, participants who ate about 1.5 ounces of pistachios daily for 4 weeks experienced an average reduction of 4.8 points in systolic blood pressure. Similar results have been found with almonds and walnuts. What's particularly interesting about nuts is that they appear to help reduce blood pressure both in the short term, likely due to their L-arginine content, and in the long term through their beneficial effects on arterial stiffness and endothelial function. Despite their high calorie content, research consistently shows that regular nut consumption is associated with lower rates of obesity and heart disease. Their combination of protein, fiber, and fat helps create a feeling of fullness that can actually help with weight management when they replace less nutritious snacks. A reasonable goal is to eat a small handful, about 1 to 1.5 ounces or 1/4 cup of unsalted nuts daily. Variety is beneficial, as different nuts offer slightly different nutrient profiles. You can sprinkle chopped nuts on salads or oatmeal, spread nut butter on whole grain toast, or simply keep a small container of mixed nuts with you for a portable, blood pressure-friendly snack. Always choose unsalted or lightly salted varieties, as the sodium in heavily salted nuts can counteract their blood pressure-lowering benefits. And be mindful of portion size. While nuts are incredibly healthy, they are calorie-dense, so a small handful is plenty. The 8th and final food that can help control your hypertension naturally is dark chocolate and cocoa products. Yes, you read that correctly. Chocolate can be good for your blood pressure. But not just any chocolate. Dark chocolate with at least 70% cocoa content contains compounds called flavonols that have been shown to lower blood pressure, improve blood flow, and make blood vessels more flexible. A meta-analysis of 15 studies found that dark chocolate or cocoa reduced systolic blood pressure by an average of 2 to 3 points and diastolic pressure by about 2 points. While this might seem modest, it's significant for a food that most people consider a treat rather than a medicine. The flavonols in cocoa work primarily by increasing nitric oxide production and activity in the endothelium. They also have antioxidant effects that protect your blood vessels from damage. For therapeutic effects, aim for about 1 ounce or 30 grams of dark chocolate containing at least 70% cocoa daily, or 1 to 2 tablespoons of unsweetened cocoa powder daily. The higher the cocoa percentage, the more beneficial compounds, and the less sugar. Unsweetened cocoa powder is particularly versatile and can be added to smoothies, oatmeal, yogurt, or used to make a rich, satisfying hot cocoa with your milk of choice and a touch of natural sweetener like stevia or monk fruit. Be careful with commercial cocoa mixes and chocolate bars with less than 70% cocoa, as they typically contain high amounts of sugar and little of the beneficial compounds. Also, dark chocolate does contain some caffeine and related compounds. So, if you're sensitive to these substances, consider enjoying your daily portion earlier in the day rather than before bedtime.
Now that we've explored these 8 powerful foods individually, let's talk about how to combine them for maximum benefit. One of the most well-studied dietary patterns for blood pressure control is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This eating pattern emphasizes many of the foods we've discussed, plus whole grains, lean proteins, and low-fat dairy, while limiting sodium, processed foods, and added sugars. Studies show that following the DASH diet can lower systolic blood pressure by 8 to 14 points, which is comparable to the effect of some prescription medications. The Mediterranean diet, which includes many of these same foods along with olive oil as the primary fat source, has shown similar benefits. What's particularly powerful about these dietary patterns is that they don't just address one mechanism of blood pressure regulation, but multiple pathways simultaneously. For instance, when you combine the nitric oxide boosting effects of beetroot and dark leafy greens with the endothelial protecting properties of berries and dark chocolate, and then add the mineral-rich profile of nuts and the omega-3s from fatty fish, you're giving your cardiovascular system comprehensive support. Think of it as attacking the problem of hypertension from all angles rather than just one. Let me share a simple daily meal plan that incorporates all 8 of these powerful foods in delicious ways. For breakfast, try a smoothie with spinach, berries, and a small handful of cocoa powder, with a small handful of walnuts on the side. For lunch, a large salad with mixed greens, roasted beets, pomegranate seeds, and grilled salmon, dressed with olive oil and garlic. For dinner, a stir-fry with more leafy greens and a few crushed cloves of garlic, with a square of dark chocolate for dessert. With a plan like this, you're not just eating to control your blood pressure, you're eating for overall health and longevity. And the best part? These foods are delicious and satisfying, making this approach sustainable for the long term, unlike restrictive diets that leave you feeling deprived. It's important to mention that while these foods can have significant benefits for your blood pressure, they work best as part of a comprehensive approach to cardiovascular health. Regular physical activity, stress management, adequate sleep, and limited alcohol consumption all play crucial roles. And if you're already on blood pressure medication, don't stop taking it without consulting your doctor. These foods can work alongside your prescribed treatment, and in some cases, your doctor may eventually be able to reduce your dosage as your natural approaches take effect. Always keep your healthcare provider informed about the dietary changes you're making, especially if you notice your blood pressure beginning to drop.
For those of you wondering about the scientific evidence behind these recommendations, I want to assure you that everything I've shared is backed by peer-reviewed research. The effects of these foods on blood pressure have been documented in numerous clinical trials and observational studies published in respected journals like the New England Journal of Medicine, JAMA, and Hypertension. These aren't folk remedies or fad recommendations, but approaches supported by modern science. At the same time, it's worth noting that individual responses to dietary changes can vary. Factors like your genetics, the severity of your hypertension, your age, and your overall health can all influence how much your blood pressure will respond to these foods. That's why it's so important to monitor your blood pressure regularly as you incorporate these changes, ideally with a home monitor that's been validated for accuracy. Some of you may be wondering how quickly you'll see results from incorporating these foods. Based on the research and my experience with patients, some foods like beetroot and garlic can produce noticeable effects within hours or days, while others like nuts and fatty fish tend to show their benefits over weeks of regular consumption. As a general guideline, commit to these dietary changes for at least 8 to 12 weeks while monitoring your blood pressure regularly. This gives your body time to respond and allows you to see meaningful trends rather than day-to-day fluctuations, which are normal with blood pressure. Many of my patients begin to see significant improvements within the first month, but the benefits continue to accumulate over time as your vascular system heals and adapts.
If you've struggled with blood pressure control despite medication and basic lifestyle advice, don't lose hope. I've seen remarkable transformations in patients who were told their hypertension was resistant to treatment or that they'd need to be on multiple medications for life. Often conventional medical advice focuses too narrowly on sodium restriction and doesn't address the many other dietary factors that influence blood pressure. By taking this more comprehensive approach, targeting multiple mechanisms with these 8 powerful foods, even challenging cases of hypertension can show improvement. Your body has an amazing capacity to heal when given the right tools, regardless of how long you've been dealing with high blood pressure or your family history of the condition. One question I often receive is whether these dietary approaches can help prevent hypertension if you don't have it yet, but perhaps have risk factors like family history or advancing age. The answer is a resounding yes. In fact, the earlier you incorporate these heart-healthy foods into your diet, the more protection they can provide. Research shows that vascular damage begins decades before clinical hypertension appears. By supporting your endothelial health and overall cardiovascular function now, you're making an investment in your future health that can help you avoid or delay the onset of hypertension and its complications, like heart disease, stroke, and kidney problems. Prevention is always more effective than treatment, and these foods offer some of the best preventative medicine available.
For those of you caring for older family members with hypertension, it's worth noting that seniors often respond particularly well to dietary interventions for blood pressure. Studies show that the aging cardiovascular system can be especially responsive to the nitric oxide boosting effects of foods like beetroot and dark leafy greens, and to the mineral content of nuts and vegetables. Additionally, these foods can help address other health concerns common in older adults, such as inflammation, cognitive decline, and decreased immune function. However, older adults may have more medication interactions to consider and sometimes have different nutritional needs, so professional guidance is particularly important in this age group. If you're feeling overwhelmed by trying to incorporate all these foods at once, remember that even small changes can make a difference. Start by adding just 1 or 2 of these foods to your daily routine, perhaps beginning with the ones that appeal to you most or that fit easily into your current eating patterns. Once these become habits, add another food and then another. Gradual, sustainable changes are much more effective than dramatic overhauls that you can't maintain. Every single step you take toward a blood pressure-friendly diet is a step toward better health, even if you're not perfect all the time. Consistency matters more than perfection. I want to be completely transparent with you. While these foods can work wonders for many people with hypertension, they're not magic bullets that work overnight or in isolation. They're powerful tools in your heart health toolkit, but they work best when combined with other lifestyle approaches like regular physical activity, stress management, and quality sleep. They also work better for some people than others based on the underlying causes of their hypertension and individual biochemistry. That said, the beauty of this food-based approach is that it comes with no downside. Unlike medications, which often come with side effects, these foods bring multiple health benefits beyond blood pressure control, supporting everything from brain function to immune health to cancer prevention. So even if your blood pressure response is modest, you're still nurturing your body in profound ways. If you've made it this far, you probably know how difficult it is to live with uncontrolled blood pressure. That constant worry, medications with side effects, restrictions that seem to steal little joy from everyday life. I want you to know that you are not alone on this journey. Our channel was born precisely from the desire to create a supportive community for people like you who are seeking natural and effective alternatives to care for their cardiovascular health. Each week, we share new discoveries, simple recipes that help control pressure naturally, and answer questions that doctors often don't have time to explain during consultations. If this content made sense to you, consider subscribing to the channel and turning on notifications. This way, we can walk together on this health journey, one step at a time, without rushing, but with the consistency that your heart deserves. I don't promise miracles, but I guarantee honest information based on serious research and the experience of those who have already achieved real results. Take good care of yourself, and I hope to see you in the next video, where we'll continue our conversation about how to live better even with hypertension. Your heart thanks you for every little care you dedicated to it today.